and welcome to Information Please, your Peoria Public Library on the air. I'm bringing you information about your library and your community. And this evening we're privileged to have Greg Chance, who's the administrator of the Peoria City-County Health Department. Hi, Greg.
Thank you.
Thanks for coming. And I usually don't have my table covered with papers like this, but there's so much to talk about, and with health we want to talk about facts and figures, and I want to get it right. So I have to pardon my messy desk here. I'm really interested in some of the things you've brought to my attention, like our, this is rankings in Illinois, where we rank, and priorities for the County Board of Health. And so maybe we could start off talking about that. This says that with a needs assessment, our priorities are obesity, oral health, and reproductive health. So how do we get to that conclusion that that's what we want to focus on?
Well, I appreciate your review of that. And the community health needs assessment and planning effort is really a culmination of about 18 months of work facilitated by the health department. And I like to emphasize that the community health improvement plan isn't the Board of Health or health departments, it's the communities. And we just facilitate the planning process.
Interesting.
Our vision is the health department promotes health and wellness in the community through a collaborative process, and really wanting to engage the tremendous amount of healthcare providers and human service providers that we have in our community, as well as social service agencies, to improve the health and welfare of Peoria County residents. How to do that is to take what resources we have, identify our priority health issues, and hopefully through a collaborative process, engage the right stakeholders in terms of seeking health improvement. So the 18 months, we looked at data, statistical data. We also talked to key stakeholders. We talked to those in the healthcare community. We talked to those in the neighborhoods, in the faith community, in other social service and human service fields, and talked about what are they seeing with respect to the health of Peoria County. Additionally, we solicited input via focus groups and other types of opportunities to collect input. We had a citizens group that steered this process with the aid of the health department staff. It was chaired by Farrell Davies, the executive director of Heartland Community Clinic, and Ross Black, who's with the city of Peoria, as well as we had a number of other key stakeholders part of that steering committee. Culmination of the effort was based on the data, as well as based on the input that we received from the community. These areas of obesity, oral health, and reproductive health came out as areas of health within our community that we really aren't doing well when we compare Peoria County against other counties of similar size and demographics in Illinois, as well as what our goals are at the national and state level. So we have some challenges. And the dilemma we have with population health is you don't see improvement in a short time period.
Right.
If we're really going to see a reduction in the level of obesity in our community, we need to measure that in decades. And especially in this era of very tight economic resources at the local, state, and national level, it's difficult to go to our policymakers at county government level, city government level, state of Illinois level, and well as federal government say, we need X amount of dollars, and in 10 years you're going to see a reduction in obesity. And it's difficult for them to make those difficult decisions. So the document is intended to engage the community, hopefully provide the opportunity to facilitate a collaborative process and engage the appropriate stakeholders. And obesity is a perfect example where everybody has a stake in our level of obesity, whether it's our neighborhoods, our families, our schools, our city government, our county government, and our healthcare providers. So there's a role for the whole spectrum of our community to help improve or address the issue of obesity across this entire span of a lifetime.
So will we see, like a major marketing advertising push from your organization, or will you just give people will work from all directions?
Well, we have a couple of things working. We have a work group comprised of stakeholders representing social service agencies like Quality Quest, the YMCA, the YWCA, the Carver Center, and we brought in healthcare providers representing our healthcare institutions, OSF, Methodist, Proctor, as well as other interested stakeholders. They've been talking about, well, if we really want to improve the issue or address the issue of obesity, what are our primary issues? And we've talked about the issue of nutrition, how to improve nutrition in our community. How do we provide access to healthier foods in our community? How do we increase physical activity in our community? How do we create a community that promotes health and reduction of obesity? And there's various factors that influence that. It's one thing to advise individuals, you need to be more physically active, but how can we as a community help that individual achieve that? Do we have the neighborhoods that you can get out and walk in? Do we have sidewalks available to them? Do we have other opportunities in terms of physical assets in our community that can be utilized to allow individuals to be physically active? And we're not just talking about needing to buy a pass to a gym and go work out. We're talking about just get active.
Right.
And how can we use the resources we have in our community to do a better job of facilitating that process? And then the issues in terms of nutrition and diet. There's so many different opportunities we have in this community, starting with what we serve at our family meals, what we eat when we go out to eat at our various food service establishments and retail outlets in this community, as well as what do we serve in schools.
Yeah, school's a big issue.
And so how can we work collaboratively, address some of the barriers that we have currently in place, and start moving Peoria towards a healthier community? And we believe the health department's role is, we're just one piece to a very large puzzle. And so we see our role, though, as hopefully engaging and maybe it's sometimes challenging the community. Here's what we need to do. Here's how we think we can do it. But let's have some discussions and let's get moving.
Great. Well, I can tell you that, we know at the library that this process of engaging the community works because people are still coming into our, remodeled new facilities, and they'll say to me, well, this is great. How did you come up with these ideas? And I tell them, these all came from the community.
Right.
We had so many, interviews and focus groups and surveys and, 40 community members that said what we wanted. And through all of that, we got that process. So yes, this process does. I mean, you can use the library as an example of how well it works when the community works together.
And one key component of all this is having a better informed community.
Right.
And that's an individual responsibility, but how can we in the public sector, like the library, like the health department, help create a more informed community? Because as we look at our health challenges, we really need to get out of this mindset of someone else is going to help solve our problems.
Yeah.
We need to take personal responsibility because a large spectrum of our challenges in terms of health are related to self-behavioral choices.
Right.
And we need to make better behavior choices in terms of our own health.
Right. And you've given me a perfect opportunity here to talk about what the library does, because of course what we're here to do is give people valid information. And the way we often do that now is with our electronic databases that are accessed through our website. Of course, if somebody doesn't know how to do that, the librarians will do it for them. But 24 hours a day, 7 days a week, anytime with your library card and your PIN number, you have to remember to get your PIN number, you can go onto our website in our e-library. And one of the databases we have is the Gale Health and Wellness Resource Center. And right on the top, we have diabetes, obesity, cancer, depression. It's, list of diseases and conditions, and you just click and you can get articles and you can go deeper and deeper and deeper. Alternative medicine, drugs and herbal remedies, directories, dictionary, trusted sites, health assessments. You go through, and there's always an article on what the topics in the news are. So this is one of those things people can do for themselves if, your doctor mentions you have this, your husband, your child, whatever, or you're reading about it, you hear about it, you want to know more, you want to be well informed, you can just go to this website and, you're not Googling. If you Google something, or I should say use any search engine, you don't know what kind of information you'll get. But we use your tax dollars to purchase this database that is, valid resource, researched information so that people can get accurate information. They may not be able to get that from their doctor or your health department at midnight when you're awake, panicked about something you just heard about. It's always good to come home and get your test results at 9 o'clock at night and not be able to ask a question. But the library lets you do that. And of course, we have all sorts of books and DVDs, even audio books that are health related. And we are keeping a very close eye. Some people panic. They go, "Why are you throwing away those books?" You know, because you never throw away books. But one of the things we keep a close eye on is getting rid of old information.
Sure.
It's very, you know, there's new scientific advances all the time, and so we may have, you know, encyclopedias of information or books on conditions, and we keep a very close eye and we remove them because we don't want to give out invalid information.
Well, and that's a valuable resource because in any kind of health issue, we need a better formed community.
Exactly.
And we need individuals asking the right questions of their medical providers, of the health department, of others. And one opportunity is to take advantage of the resources at the library to become better informed.
Yeah, and then you can ask your doctor a better question. Let's go back and touch on this topic again of where we sit in Illinois. And there's this county health rankings, and it's about Illinois and lots and lots of information. And clinical care, this talks about, you know, length of life, morbidity, and what goes into that fact, and clinical care. So why are we not at the top? Because we have 3 great hospitals.
Well, I think the County Health Rankings report, which is funded by Robert Wood Johnson, and I think it's about 3 or 4 years old now, comes out every year and looks at the health of the residents of the 102 counties in Illinois, and really brings it down to a layperson's understanding in terms of how do we compare to Henry County, to Tazewell County, in terms of the health of the community, and how do we compare it to the state of Illinois as a total. And it does an excellent job of looking at the factors that influence health in the community. And typically, when we have this type of discussion, whether it's here at this table or at the coffee shop downtown or at the city council level or at the state of Illinois General Assembly, when we talk about health, we typically want to talk about health care. Right. And as you just explained, we have a tremendous healthcare system in this community. In fact, we're ranked in the top 5 of counties in the state of Illinois in terms of access to healthcare, which is wonderful. Yeah, you can find the doctor you need. The dilemma, though, is in terms of our health, in terms of health outcomes, we rank about 61st out of 102 counties. So we're about in the middle of the pack. Not good. So the conflict is, well, how can we have such a great healthcare system but such poor outcomes in our community? And so the County Health Rankings report talks about the other factors that truly influence health. And it really focuses in on or highlights the areas of behavior and those other socioeconomic factors that influence health. Household income. Right. If you live in a lower income household and you have to make very difficult decisions regarding paying the energy bill or paying for a healthy meal that night, those become very difficult decisions. Right. And so we know that socioeconomic factors influences the health of that household, of that neighborhood, and of that community, and also behaviors. Especially when we talk about the priority health issues in our community. We know that decisions about smoking, decisions about alcohol intake, decisions about physical activity, and decisions about when you seek health care, preventive health care, all influence your personal health, and then obviously then affects the health of the community. So how do we look at those behaviors and positively influence those behaviors so that we have healthier individuals, which ultimately result in a healthier population? And so how can we spend more dollars on promoting health and wellness as opposed to treating the sick? Right. And that's really a change in the whole healthcare system. I think we're going to embrace this much more effectively in the near future as we continue to see healthcare reform at the federal level move forward. And I know there's a broad spectrum of opinion regarding healthcare reform, and there are good, like any piece of legislation, there's good things about it and bad things. The one good thing that I see is that there is emphasis on health and wellness and prevention within the federal legislation. That's good. And so let's see how we can take advantage of those opportunities here in our community, in the Tri-County area, and Peoria County specifically, and as a system, utilize those resources to improve the health of Peoria County. That's great.
great plan, long-term plan.
Yes, and that's the dilemma, and I appreciate that. We're in a society that likes to see results immediately.
Exactly.
Unfortunately.
Yeah.
And in public health, we're kind of like the tortoise. We tend to move slowly to really gain things. But, you know, in terms of what our focus is, you know, I like to say we live longer today, not because of advances in healthcare necessarily, but advances in public health. Think back to the 19th century, how many deaths we had due to typhoid, how many deaths we had due to diphtheria, smallpox. We don't see those infectious diseases, knock on wood, today because of public health efforts.
Right. And I was actually going to bring up is this ties into, I think, the very early days of public health is, you know, a conflict the library dealt with. As you may know, our Lincoln branch is 100 years old, and it is built on the site of the first city cemetery. And I had the opportunity to work very intensely with the archaeologists, and they could often tell what people died of. And the controversy about that were people said, why is this library on top of the cemetery? And I'd have to go into a long explanation of one of the first things the state of Illinois did was they said, no more cemeteries where people are drinking the well water. And we had people dying of yellow fever, of cholera, of diphtheria, of measles, you know, all those things, and being buried, and somebody's got their drinking well right next to it. And these are folks who are buried in a wooden coffin. And I'm not an expert, and I actually haven't been able to find out if yellow fever can spread through groundwater, but I did find out some of the other diseases can and actually cause that. These burials were disturbed or something. And so I had to explain to people, well, Springdale was so far out of the city at that point, and they started Springdale so that people would not be buried where people had drinking wells and moved them. And people could not understand that concept at all. And of course, then you get into the whole other issue of, but why are they not moved? Well, we don't know. And the city council records are lost, and the cemetery was just taken out of service and sat there, and people forgot. People hadn't been removed because the records said removed them. So, but it is interesting to me, and I wonder about the early public health in Peoria with those diseases, but a lot of those things stopped with early movements, like something as simple as keeping that out of the groundwater. And now we're lucky we don't have to deal with that, but now we're just, back then you didn't have to worry about exercise.
Well, and
you know, but now it's changed.
That's where we've seen a movement, thankfully, due to influence of public health efforts as well as collaborating with the healthcare community. We don't have the infectious disease concerns that typically were resulting in premature death in our community, et cetera. But we're now dealing with chronic disease issues like diabetes, high blood pressure, asthma, those types of illnesses that reduce the quality of life as well as impacts our healthcare costs. So it drives everything up. So those efforts in that example in terms of the benefit of a investment in public health, and it doesn't mean the governmental Peoria City-County Health Department. There's a myriad of entities that influence the public's health. And I would suggest here in our community, we haven't been so effective at collaboration. We have a lot of things going on in our community that tend to be siloed.
But not together.
Part of my job as a public health officer for Peoria is to do a better job of engaging those partners, whether it be my friends at the 3 hospitals or in the health and human service agencies or the mayor for the city of Peoria or West Peoria. How can I better, more effectively engage those individuals so we do a better job with what resources we have to truly make good impact on health?
Well, and I think it becomes an issue of making people aware that any decision they make about their business or the way things are done can have an effect on public health. And so that always needs to be a factor when we're making those decisions. Which is why at Peoria Public Library, when we put in vending machines, there is only juice and tea. There is no soda available to the public.
Excellent. Perfect example of something that we can do to affect change. And
exactly.
The library board made that decision.
Now,
how can we use you as an example to encourage other school boards, other private entities saying the benefits? So it's in the best interest of the employers in our community that we have a healthier workforce.
Yeah, we may have had an advantage because we had never allowed drinks in the library, but in 2 libraries we put in the little cafes where people can, bring their lunch and eat, and and buy, and this is the public, and as long as you have a cap on the drink, you can have a drink in the library. But the library board said, we are not going to have soda available. We are not going to have teens coming in and buying soda, you know, and drinking soda. We're only going to offer juice and tea. And so no one has complained, but then again, the soda wasn't taken away. They're just excited to have it there. But it is a good example, and I think very thoughtful and, you know, forward-thinking and worried about public health in the design of these buildings.
Yes.
And what services would be offered. So, well, you mentioned, you know, health challenges and public health, and I know there's a lot of concern about whooping cough and the flu right now. So are those our two biggest challenge, you know, just immediate challenges right this minute, or?
And that gets back to infectious disease.
Yes, it does.
Who would have thought that we'd be worried about whooping cough in 2012? But it's an example where we've relied on vaccine to prevent a disease that in the 19th century took a tremendous number of lives in our community, especially with our young infants and impacting families. But through the advent of vaccines and the administration of those vaccines at the appropriate age level, we've seen a tremendous reduction in the number of pertussis cases or whooping cough that we see in the state of Illinois and in the nation. However, we've now seen that pendulum swing back the other way for a variety of reasons. We have a certain segment of our communities that do not readily agree with current public policy regarding vaccination, so they respectfully decline the opportunity to be vaccinated. Additionally, we are now learning that the immunity created by the vaccine does not last as long as we thought it did. And so we are now seeing pertussis or whooping cough back into our community. Fortunately, we haven't seen the outbreaks to the numbers in Peoria or the Tri-County area that we have seen in northern Illinois, especially in the Chicago metropolitan area. They have a huge number of cases in a number of counties, and they've declared epidemics in certain segments of those communities.
And that's not something we have worried about or heard about
in the last
these
25 years.
You know, what people consider a childhood disease, but my understanding is the problem is that adults can get it. And they may get sick, but they don't die, and young children do. Are you recommending again that adults be vaccinated?
We recommend, especially in families that are going to have new babies. And I'm not just talking about mom and dad, I'm talking about aunts, uncles, grandparents. We like to call this the cocoon effect, because infants do not get immunized against whooping cough and a number of other vaccine preventable diseases until they're at least 6 months of age or older. So those first 6 months of life, that infant is very susceptible to infectious diseases. So we need everybody in close contact with that newborn to be properly immunized. So we always stress that once you have that great news that there's going to be a new arrival in your family, that you talk to not only mom and dad, but you talk to grandma and grandpa, aunts and uncles, and say, you know, we're going to have a new little one here in the household, and we'd like you to talk to your physician about where you are with respect to vaccine preventable diseases and your status of immunity in terms of when the last time you received your pertussis immunization. So this is always a good opportunity to remind.
Probably most people won't have had it since childhood, correct?
And so we always stress to talk to your physician, and based on their recommendation, be properly immunized. You can access those immunizations at your personal care provider, or always contact the health department, and we'll be glad to talk to you about those issues.
And in many cases, you can go get one at your pharmacy these days.
That's the tremendous opportunity. We have, again, another example of tremendous asset in terms of access to health prevention technology. And so as we are now getting closer to the holiday season, and there's opportunities for viruses to spread. Typically, with respect to influenza or respiratory flu, we don't see the peak occur in central Illinois until late February. So I always like to talk about the impact of the holidays and all the schools being out on holiday break.
And everybody goes across
gathering.
The country, and everybody gets in an airport. I don't seem to be able to get on an airplane without getting very sick.
So there's the opportunity to be in contact with someone that's carrying the influenza virus. And so we always recommend people to, if you're sick, take appropriate precautions, cover your mouth, wash your hands frequently, and if you're not sick and you haven't received your seasonal flu shot, go get your seasonal flu shot before the holidays begin.
And many workplaces and insurance companies let you do that for free now. and it's just a matter of not wanting to do it.
Yeah. And then the other issue is we did recently have some media attention to a stomach flu outbreak we had. And so that's another example where personal hygiene, washing your hands. Norovirus is the family of viruses that typically cause most stomach flus, where you have extreme symptoms related to the stomach flu for 24 to 48 hours, and then it's gone again.
Yeah.
And those are related to a very vigilant virus that can live on our hands and on inanimate objects for a certain period of time. So, but the only way that that virus can be spread is someone that's carrying the virus, and somehow that virus ends up in another individual's mouth, and typically it's hand-to-mouth contact. So, especially during the holiday season, wash your hands. What you were told by your mom and dad years and years ago, and in my kindergarten
And so you're traveling and the only place to go is the horrible restroom in the awful gas station. So do hand sanitizers do a good job?
Well, we always recommend use soap and water first. And then if you have a question, then use a hand sanitizer as a secondary prevention barrier. But you can't beat soap and water.
Right.
And I was just talking to a colleague the other day, and he walked in on his granddaughter. And his granddaughter was washing her hands thoroughly at the kitchen sink and singing happy birthday. And she was taught that at school. What a wonderful opportunity. The teacher of school talked to them about how long you need to wash your hands, because we all know kids, it's boom, get it wet, wipe your hands, and I'm out the door. She was sitting there, and they were advised, wash your hands, and to ensure that you're getting everything, sing happy birthday, 2 verses, and that's the proper length of time under the warm water with soap to get them properly cleaned.
Great. Thank you so much for coming and joining us. I think this has been very enlightening to a lot of people and given us an opportunity to talk about our health and wellness database. So I hope you'll use that too.
Yes, I will. I appreciate the opportunity to have a discussion.
Great. Thank you so much for joining us on Information Please.